DBNC Leadership podcast where we share real stories of amazing leaders in our community. I am your new host, Mansi Gandhi. Elevate highlights leaders who live outside the narrow lens of expectation by learning what their leadership journey looks, sounds, and feels like. So stay tuned to hear some powerful stories that will inspire you, challenge you, and remind you that leadership comes in many forms. And here at Elevate, we celebrate them all. Welcome to Elevate. My name is Mansi Gandhi, and here we have a very special guest, Liben. How are you doing?
Thank you very much for the invitation. I'm feeling very good and I'm very, very pleased and honored to be here with you to have a conversation.
We would love to hear a little more about your journey at TAIBU. How did you get inspired to start this role, and then how was your background help you shape this role?
So, I think I probably started a few years before I joined TAIBU. My background, initial background in my education, I graduated with a degree in economics a few years ago. I won't say how many years ago. And then my field of work was predominantly in government when I was back in my country in Ethiopia. It's only when I moved to the UK in the early 90s, I don't know if it is by chance or by divine intervention, I started working and initially volunteering in a child and family center. And then after volunteering, I had the opportunity to apply for a job there as a frontline worker. The title was a family support worker. And that's when I really found out technically who I was and what my passion was in terms of what I wanted to do. I didn't realize what I really wanted to do before then. And so when I joined there, I had a very great manager and mentor supported me to grow in the work of supporting people. And so she really advised me to get into social work. As I was applying to apply for a social work course, you have to write your kind of personal statement why you want to join this. And I sat down to write why I really wanted social work. And that's when I really found out that I really enjoyed and was passionate about working with people and serving people and supporting people. And so that's where the journey started. So I became a social worker. I was doing a lot of work with refugees, asylum seekers, newcomers, vulnerable people, people in low-income neighborhoods and stuff. So then I grew into that field, and then mental health was a very significant challenge in those population, and so I also felt that I really enjoyed supporting people go through their challenges and their traumas. So I did some counseling training, and then I became I added social work and therapy, and so I started doing work with refugees who had experienced trauma, civil war, all those kinds of things. Right. And then again, through the support of my manager, again, I did my master's again in mental health and social care. So that was my experience in the UK, and then I moved to Canada in early, around 2005, and started doing the same work in a family center, doing therapy with families and children and youth. And this opportunity, I didn't know, I just saw this job posting about this new organization being established, and they were looking for an executive director. And all the job the job description, really I could tick all of those to say, oh, I've done this, I've done that, and this is the qualification. And I think by divine intervention, I was being prepared for this role, I felt. And I was very honored when I went through the interview process. And actually, after the interview process, there was a long pause, and I don't know what was happening. And then I said, you know what, maybe I didn't make it. So, and then after 2 months or 3 months, I was called again to say, hey, we're offering you the position. So I think I was being prepared for the role. I'm very, very blessed to have been in the organization from the very beginning, and where we are today. So I think the passion about working with people and serving people is what is in me, and that role really helped me to establish. Of course, my role is very administrative now, so I find it boring sometimes to just sit and be in meetings and doing reports and stuff like that. They say once you're a social worker, you're always a social worker.
Absolutely.
And so sometimes I find I have this urge to go out and speak to people. So I go out in the waiting area and speak to people who are there, who are in community programs, who are there for their appointments. And I just go and speak to them and say, hey, how are you doing? Are you being served? Some people will look at me funny and they say, who's this person, like randomly speaking to us? But for me, the connection with people is the most important thing, and supporting people, I think, is the best service that you can provide.
Absolutely. I definitely agree with you because being a front face all the time gives you that urge to be back in the front facing where you wish to talk to people, where you want to know more about how they feel.
It's important, but it's not what I always want to do.
I understand.
And I do work in my community. People approach me to help them with services. So I help them with system navigation and stuff.
That's amazing.
That's what I love to do.
That's awesome.
Yeah.
Being a people's person is
Yeah.
what you are.
Yeah.
I must say, what an amazing journey. It actually prepared you for what TAIBU is today and what you are doing for TAIBU. It's really commendable, I must say.
Thank you. Yeah.
Considering we're talking about TAIBU, if you could help us understand that what TAIBU means and how did that name come into picture. I understand that in Swahili you say TAIBU, but what does that mean?
Thank you. That's a very, very good question. A lot of people think that TAIBU is like an acronym. T stands for something, and E
Right.
stands for something. But it goes back to the founders of the organization. Dr. Christopher Morgan is the person who founded the Black Health Alliance, which is the sponsoring organization that led the establishment of TAIBU Community Health Center. The idea of TAIBU Community Health Center is about focusing on the health inequities and disparities that Black communities experience, whether it is in health or in social outcomes or social status outcomes. And there were two very important things. One, as I said, the focus on Black population, but two, also, rooting this organization in an African-centered value and principles to make sure that when we say we are focused on the Black population, what we do and provide as a service is really, truly meeting the needs of people of African descent. And so the only way that you can do that is by embedding all the things that you do in traditions, cultures, ceremonies, rituals, understanding of who we are, what health means, what well-being means, all those kind of things. And so the implementation committee, as they were getting ready to finalize the establishment of TAIBU, they really wanted to give a name that encapsulates all this idea. And so they came up with the name TAIBU. It is a Swahili word. It's actually a greeting to say be in good health. So when you are greeting somebody, you can say be in good health, right? So that's where the word comes from. And so it's very important for us to always remind when we say we are working at TAIBU, we mean that we're focused on the issues faced by Black communities, but we're also rooted in who we are as people of African descent, our culture, our meaning, our gathering, who we are, what we do, how we are, all those kind of things are important for us as an organization.
Absolutely, because I completely agree with you, because it's really important to make somebody feel home and comfortable is when you have the environment where somebody can feel at home.
Yes.
And if this is what TAIBU does for them, I'm pretty sure there won't be any client who would be turning back and saying that no, they did not serve me well.
I mean, we try our best. We are an organization, so we may have our challenges and stuff. But the presentation of the organization has always been to make sure that people can connect and feel that this is about them, this is for them, and this is also with them. If you come to TAIBU, you will also see that how we have designed the space, the color theme of the facility. We didn't want it to be another office or another clinical office. So we've used colors that represents who we are as people, that has meaning. We have put in shapes and, so when people come in, they feel this presence of them represented in the facility. And so far, people when the first they come in, they'll say, "Oh, this is a really nice place. It's very warm. It's welcoming." So I think there was a lot of thought and planning to make sure that who we say we are is how people receive and perceive us as well.
Totally. That's beautiful, I must say. So essentially, when we greet each other, should I be saying TAIBU?
Yeah, you could say that TAIBU. Sometimes we do say that when we have a big gathering, and like as a wish and greeting, we do that.
That's beautiful. So TAIBU offers a range of programs from primary health care to health promotion and disease prevention. Could you highlight some initiatives that are significant to your organization?
So TAIBU as a community health center, we are an interdisciplinary primary care organization. So that means we provide primary care services with staff like doctors, nurse practitioners, nurses, dietitians, social workers, and other allied health professionals. So you could say it's just a clinic, right? But for TAIBU, we are focusing on issues, as I said earlier, we're focusing on issues that disproportionately affect Black, Francophone, and racialized communities. So, for example, within our primary care, we pay attention to diabetes, for example, hypertension. These are, a high proportion of communities being impacted by this chronic disease. So we have those special focuses. HIV is another area of work that we are engaging in recent times, knowing that the incidence of HIV, generally when you look at aggregate data, the incidence of HIV is going down in many communities, but for Black communities it's actually on the rise, and it's also very high, particularly with Black women. The incidence of HIV is disproportionately very high. So we identify these areas where we see a lot of disparities and try to address those, whether it's providing direct services or doing some studies to make sure that we raise awareness around those diseases, and we can develop some programs that are promising practices or best practices. So that's with our primary care. And then as community health centers also, there is a huge health promotion, community development, community engagement work that we do. As we all know, health is not just physical health, and it's impacted by so many social determinants, factors, income, education, employment, living conditions, all those kind of things impact people and their health and well-being. And for Black and Francophone and racialized population, the burden is even higher because in every situation, as I said earlier on, we are overrepresented, right? You look at education, high school dropout rates for Black people, even though the school dropout rate has been declining, it's still high for Black students. Suspension and expulsion for Black students. Graduation rate for Black students is very low. Post-secondary education for Black students still very low. So this then would have an impact on employment, that would have an impact on income, would have an impact on social well-being and networking. Mental health is another big factor that we encounter. COVID did not help; it actually exacerbated many of the situation. So we do a lot of community programs, or what we call our community programs and services, that is focused on these areas, supporting Black students in school, doing a lot of mental health work, whether it's direct services, raising awareness around mental health issues, lifestyle modification, providing education, physical activity for people to kind of address their challenges, situations, housing, So we have a large team, and most of the work that we do connects with the primary care, and we work together to do that. And then over the last 3 years, we have also been leading in the establishment of the Toronto Community Crisis Service. You may recall June 2020, after George Floyd's incident, we had another incident here in Toronto where a young black indigenous woman fell from a high-rising building in the west of Toronto after police got there to do a wellness check. Right? We don't know what happened when the police were there, but she fell to her death from a very high building. That created a huge outcry. Her name is Regis Korcheski-Paquet, and there was a huge outcry in the community to address this issue. Too many people were dying after police gets involved in a mental health crisis situation. The police are not trained to address mental health issues. Right? If you have a heart attack, it's EMS that responds. When you have a mental health crisis, why does the police respond? So there was a huge outcry from community advocacy made, and the city also responded, and there was a consultation to be able to create an alternative service that is non-police led. And so the birth of the Toronto Community Crisis Support Service. And now that we have the whole of the city of Toronto has this service. And so when people are challenged with mental health crisis or they need support, instead of calling 911, they can call 211, and community organizations respond to the crisis. So TAIBU is leading that in the region of Scarborough. We're doing that. There are other organizations, so CMHA is doing the northwest part, Gerstein Center is doing the downtown core, and there is a special response unit for indigenous people. So that's also something that we do. And then we do other, projects because we believe over the last few years we have been developing our model or service philosophy. If as a black focused and black mandated organization, the only thing that we do is program and activities and nothing else changes, we will continue forever to do these programs and activities, and the situation will remain the same.
Right.
So we are looking upstream and saying we need to engage with systems to be able to influence how they are dealing with issues that impact black people, so that the system needs to change. So we have adopted what we call the system transformation approach, so that now we're working with institutions, whether it's with school. So an example I usually give is we have a project, it's called the PLAN project, and it works with black students who are at risk or are being impacted by suspension and expulsion. So we provide the service by supporting black students and their parents, either to navigate the system, or in most cases, the suspension and expulsions are based on discrimination, prejudice, and racism. So we want to address that. And we also provide legal advice and legal support. And in this project, we've had 100% success rate. Every situation that we have been involved with black students and their parents, we were either able to get the suspension or expulsion withdrawn, or the suspension reduced sometimes if there was a case to be made, but definitely get the suspension expulsion record expunged, because we know that if a record follows a student, it's always a challenge, because they will always be targeted to say, like if you move to another school and you have a record, then everybody's going to watch you to say, okay, we need to watch Mansi because like she has a record of, right? So we try to get that record removed so that people can have a fresh start. But if we just do that only and the school does not change and they continue with the same rate of suspension and expulsion, we have to find money to continue with this program, but nothing else changes. So in these situations, we work with the school and we say, okay, there are certain things that maybe we can find a different way to navigate disciplinary measures. Can we negotiate that? Can we do that? Can we do some training with the staff around anti-black racism? That way, maybe the school will find new ways of dealing with issues that they face with black students, and maybe they would, instead of, going straight to suspension and expulsion, there are some things, other things that they can do. So we can work with them to do that. And if the school changes, then we will see the reduction of suspension and expulsion. And we can use different examples like that. So we're always working with systems. Right? So we work with schools. We've started working with children aid services, right? Again, the same thing, disproportionate number of black parents and children in care. 40% was the number we had a few years ago. Maybe it's gone down a bit now because there's been a lot of attention and stuff. But still a higher number of children who are in care are from black and indigenous communities. If children aid services does not change the way they are dealing with child cases, we're going to have the same problem. So we need funding to address this issue. So our plan is to get TAIBU out of business, right? Because TAIBU was created to fill a gap, because the system was not doing what's expected to do. So that's why we needed a special program or a special service that is focused on black people.
Right.
If we do the work that we need to do in the long term, every service, healthcare, education, police, everybody can respond the way that they should be responding. So that's the approach that we have. And so when we focus on program and activities, we do what we need to do today, but we're also looking upstream to say, how does the system need to change? Yeah. So we have a lot of other programs that we do. Like we do these activities, but we have the system transformation idea, so we do a lot of research, best practice development, as I mentioned earlier, working with systems and doing evaluations to see how we're changing situations. We do systemic big advocacy work that we do. We have developed documentaries that we are using and going into different organizations and systems to start conversation about changing, right? We do work with boards and governors, for example. That's a very significant space where change can happen very easily, right? Boards is where decisions are made, policies are made, financial disbursement, resource allocation are made at the board level.
Right.
If the lens of boards is more community driven, they have this equity lens, they can bring so many changes in an organization that can happen, right? So we do this training and engagement with different boards to have this conversation, so they can also think differently from what they were doing. A lot of boards, especially after George Floyd, have been trying to increase the number of black racialized communities on representation on the board. And they try as much as possible to recruit and stuff. And when I speak to boards, they say, oh, we have difficulties. Like, we do all these things, but we cannot recruit. And I'm saying a lot of people need to know about the organization, trust the organizations before they can join the board. Because sometimes when you join the board, it could be even more difficult, right? If the space has not been, like they haven't done their homework. So those kind of systems change ideas is also very, very important for us. So we do primary care, we do the community programs with different health promotion, health intervention. We have the crisis response support, and we have a few other mental health and working with CCS and stuff like that. But we're also looking at big pictures and bringing some system transformation ideas as much as we can.
You deal with a lot of different high-level organizations here. I'm curious to know what kind of challenges do you face, because they would have their mindset on things, they'll have their set priority. Now here you are where you're introducing something where you want to change the system or probably tweak the system, let's put it that way.
Change the system.
Okay, let's use the word change the system. So then I'm a little curious here.
So it's a very good question, and the way I see it is, it's not to say that there are no challenges, but I see them as opportunities. Probably working in this kind of area around equity and addressing racism, anti-black racism for us is very, very tiring. It's very difficult. So I'm not discounting that. But if I see it as a challenge, and it's always a challenge, for me, individually, I think I find it very difficult because it's overwhelming.
Right.
It's very, very overwhelming, and you don't know where to start, or you don't even, sometimes you see, really, is this going to change at all? because it's very ingrained into the fabric of the society and institutions, in the legislations, right? It's very deep-seated. It's not something that happens like on the surface. It's very deep-seated. That's why we say it should be a systems change, because the system, the society, the culture, the institutions, the way things work were never designed for Black, racialized, indigenous, Francophone people. All the system that we see, the education, everything was designed for the white settlers in this country, right? So some people say, oh, the system is broken. The system is not broken. The system is working perfectly as it was designed. So now we are coming here, a small organization, right, in the city, located in the northeast corner of Scarborough, and talking about change. I mean, forget about change. Even talking about the mandate that we have of serving Black communities across the GTA, that's very overwhelming, right? And the system does not want to change. So it is a challenge. But for me, the way I see it is, I look at every small windows of opportunities to be able to do something there. Otherwise, it's very overwhelming. It is too much to take on as a leader of an organization. And so I see it as opportunities, and I look for windows. That's how I navigate the system. Any opportunities that I see, then I'll say, okay, maybe this is a good way. It gives us an entry point. I have been saying for the last 5 years, COVID has given us the best opportunity. I mean, it was horrible. We've seen it in our neighborhood. It's also devastated a lot of our communities, from Black, indigenous, racialized communities were the most impacted. But there was also an opportunity that we saw. The system, meaning the government, both at the municipal level, at the provincial level, at the federal level, completely threw out the way they were working and created a new way of working, because they had to respond to this urgent issue. And we did some work together with the governments. With the City of Toronto, we did a lot of work with them. The province, they did a lot of investment, looking at different neighborhoods to bring changes. The federal government provided support and stuff like that. It has never happened in the history of any, I think, nation. That's a great opportunity, right? Now our fear is, the government has said COVID is done, but the communities are still suffering and struggling, right? So here is an opportunity to say to systems and institutions, do you remember how you responded to the COVID situation? You can still respond to this situation differently than the way you're doing, and the same way that we saw good results during COVID, we can get the results now. So this is a way of language and communication and engagement that you can have to do. If the government has tried it once and this way it's working, they might agree to flex and be flexible to situations. So unless you see these as opportunities to bring about change, it's so overwhelming and the system is very difficult to change that you are not able to survive, or you can't have a healthy survival process if you are trying to navigate a systems change approach.
Of course, because these are, as you rightly point out, they are grassroots level changes that we're talking about. And to dig that deep, it requires a lot of patience. It requires a keen eye, as you rightly pointed out. Be there at the right time and the right place to actually put your suggestions and your opinions. So yeah, I think you're doing an amazing work for the community, I must say.
Thank you. Yeah, it's good. It's good. It's very, like, it's small steps, small changes, and you have to acknowledge and celebrate those small things, right? In order to see the bigger picture.
Absolutely.
Otherwise, if you're always looking at, what's not happened, it's very tough.
For sure, definitely. Considering we're talking about challenges, as a CEO of TAIBU, what kind of challenges do you think that you face?
I mean, it's not a challenge that I like. I just like any other CEO. It's, the position can be isolating sometimes, right? Sometimes you may feel that you are on your own, right? you're in between your staff and your board, right? And sometimes there may be things that you're not comfortable sharing with your staff, and necessarily not sharing it with your board. So sometimes you kind of feel alone in a space where you have to figure out things and stuff. So it could be challenging that way when you are at that level of an administrative position. But it's always good to have good network around you. People you can go to. Some mentors. I've been blessed with some great mentors around me. I mean, I have a great mentor. She passed away during COVID, but she's always in my mind, and I always ask and say, how would she deal with this, right? Her name is Denise Brooks. She was the executive director of Hamilton and Core CHC in Hamilton. And so she has been my greatest mentor. But there are other mentors that still are here around me, and so I go to them whenever I need advice, guidance, or even space to just express what is going on. So a good network of people around you in this situation is very important, so that you can look after yourself. And Denise is always in my mind, she's always in my mouth, and just in the spirit of like we're doing this podcast, very strong advocate and activist around anti-Black racism, poverty, and she did quite a lot of work in the province, but also I think throughout the nation has been recognized. And she wanted, this was a few years ago, she wanted to start a podcast.
Oh, okay.
And so she would call me and she says, hey Liben, we need to start a podcast, we need to take this conversation out there. And I would say, oh Denise, I don't have any clue. I say, I don't know what a podcast is. What are you talking about? Okay, I'll go research and inform myself how we can do this and stuff. And so we've been talking, and then she passed away without her realizing the podcast. So TAIBU, she's also a founding member of TAIBU. So we have started a podcast now. It's called Be in Good Health, in honor of Denise Brooks. And we want to bring these issues that we talk about: system transformation, anti-Black racism, poverty, mental health, all those kind of things, to bring conversation, just like we're having a conversation here. So, those are the moments of, for me, like people who have been involved in my journey, who have been very supportive, continue to be supportive, is very important in this position.
For sure. I mean, we definitely encourage all our viewers to listen, Be in Good Health podcast.
Yeah.
So, Liben, in your experience, how do you reckon racism intersects with other social determinants? And would you like to talk more about it? Determinants of health, essentially.
Yeah. I mean, that's what we do. So that's what we talk about all the time.
Absolutely.
But I think it's very important for us. We have developed a model of Black health and well-being. We have identified that we have three primary goals in the work that we do. These goals are prevention, restoration, and advancement. Now, when we talk about equity and disparities in health, these are, by definition, these are preventable situations, but they're also connected to unfairness and justice, right? So if there is a disproportionate impact of diabetes, or disproportionate rate of Black and Indigenous people in the criminal justice system, disproportionate rate of poverty with Black and racialized and Indigenous people, all these things are preventable, but they're also connected to fairness and justice. That's what equity by definition is. And so for us, those three goals of what we can prevent, we will prevent. What we need to address, because people are being impacted by this, we will address. But our ultimate goal is about health and well-being of Black communities. So the advancement is about communities' health and well-being.
Okay.
So that's our three primary goals. This idea at TAIBU came from an analogy that I came across. It's developed by an American doctor and epidemiologist. Her name is Dr. Kamala C. Jones. And I had the privilege of being in a presentation with her, and we had a chat, and then I started researching her. And so she's come up with this analogy where there are people who are falling down this cliff. And at the bottom of the cliff, some of them die, some of them have broken bones, some of them are hurt, right? And the system usually responds at the bottom of the cliff. So they see all these things happening and they say, oh, we need more ambulances to take people to the hospital. We need more hospital services because there are so many people who are with this complication of disease and stuff. Or another very good example is when we see community violence in a city or in the part of the city, the system says, oh, we need more police with it, right? But that's not the problem. That is the effect of the problem. The problem is up higher at the cliff, because why don't we put a safety net and prevent injuries by, catching people when they fall?
Right.
Or better, let's put a fence.
Yeah.
And let's, people should not fall. Or even better is let's move them away from the cliff. Like that's really health promotion, right? Let's keep people healthy. So we need to address the people who are at the bottom of the cliff, so that's the restoration piece. We need to prevent people falling from the cliff, that is the fence and the safety net piece. But then we need to move people away from the cliff altogether, which is the advancement piece. So that is our kind of goals. And then within those goals, we also have identified 3 foundational pillars. The first one is addressing anti-black racism, because underlying around all these disparities is racism, right? You look at black communities and the disparities, anti-black racism. You look at indigenous people and why they're struggling with all this kind of different health and social outcomes, indigenous specific racism, right? So racism is the common denominator about this. So without addressing racism, we cannot address any of the health issues. So that's very foundational for us. The second pillar for us is using Afrocentric values and principles to address these issues, right? So as I was sharing earlier on, the way that we present our programs, the way that we identify ourselves should be rooted in cultural affirming way. So when people are coming to the center, when people are coming to access services, they should feel that this is about them, this is about their culture, this is who they are, and that's where we start. So anti-black racism is our foundational pillar. Using Afrocentric values and principles in the development and implementation of our programs and services is going to be very important. And then I talked about system transformation. These are the 3 pillars. So when you say, how does racism impact? Racism is one of the main factors that is creating all these disparities, that is preventable and is unjust and unfair. So we start from that premise.
Right. That makes sense. You just mentioned Black health, Black liberation. How do you see the connection between the Black health and Black liberation, and how does TAIBU work with it?
Very, very important question, very deep question. For me, there's no difference between Black health and well-being and Black liberation. Black health or good health or TAIBU is liberation. And I think, it's not just kind of a political statement, but it's true. And we've kind of done some work around this as well. For example, we organize a national conference on Black mental health. And we've used concepts close to what you're describing here. For example, last year, the theme of this conference is called the ACNOC conference, was rest is liberation, right? And many times we see in Black and indigenous racialized communities, there's no rest, right? Whether you're working, everything is very, very overwhelming. And so looking after oneself is liberation. And so that's kind of the theme that we had. So it's very important that all the work that we do, for example, one of the African-centered values or principles that we use, it's part of the 7 Kwanzaa principle. It's called Kujichagulia. It means self-determination. Or there are other concepts like nothing about us without us, things like that, right? So the work that we do at TAIBU in some of the programs that we run is how do we make sure that the community or the clients or the participants, however we call them, are part of the process of the program. Who makes the decision about the program, right? And we start, but our aim is to make sure that they have as equal as a decision or a say in what we do as an organization. This is about them, this is about their self-determination. They will decide what happens or how they want this to happen. So that is the empowerment component of the work that we do. You know, you probably very well know about community engagement and the spectrum of community engagement, where you have inform, I think, or consult and inform are on the left corner, and then you have collaboration and empowerment at the other extreme. Right. Most organizations, when they talk about community engagement, they're talking about involving them, consulting them, informing them. Right? Those are the kind of things that we do. We never cross this line to either collaborate with them or, most importantly, empower them so they make decisions about program and activities. That's really true empowerment. And this is very important for marginalized communities, because when they're marginalized and they're not part of the center, they're on the outside, they have no power, no decision power, like they don't value, they're not valued, they don't matter. And bringing them to the center is self-determination and liberation, because once you have power to decide, you are free to decide, right? So that's the component that we try to use. And so empowering the voices of communities is very important. And that's part of health, right? It's not just physical health, but it is how people see themselves and how do they feel empowered in a situation where, so we have a lot of programs. For example, our seniors programs, all the programs of the seniors, almost all the programs of the seniors are led by the seniors.
Oh, wow.
They run a physical activity by themselves. They run a food bank by themselves. They have different programs like yoga, they do by themselves. They're very engaged. They have a council, it's called the Ubuntu Elder Council, and they make decisions about program and activity that happens at TAIBU for seniors. We're just we are marginalized on the periphery, providing them any administrative support. All the other thing happens, right? So that is really truly empowerment and liberation, because they're making decisions. And this is a foundational principle of health promotion. A promotion is to build the capacity of communities so they can make decisions about their health. That is what liberation is.
Definitely. I think it's very wisely said when you said that it's so important to give them the power, because if that doesn't happen, someone doesn't feel confident enough to bring themselves up ahead.
And we had to learn. It was tough for us even to learn to stop making decisions, right? We had to be very deliberate, because our nature is like we are the organization, we are the ones making decisions. I had to learn for myself, and I had also to remind staff. So when they would come to me and say, oh, we're going to do this and that, and I would ask the question, did you decide this or did they decide this? If it is your decision, go back, check with them, let's see if it is also their decision. If there is no issue around legal matters, any risk issues for the organization, or any financial challenges, why should we make a decision? They can make the decision and they decide. So it has worked, and when we have events, we run out of space, because as you said, they feel that this is about them. It's not an organization providing a service. This is their program and services. So they're very well engaged. There's good trust and relationship with them.
The relationship becomes much more stronger in this situation.
It is challenging for organizations, because when you give power to other people, you have to be ready to be challenged by them.
Yes.
And we found out this and learned, and they will challenge us. If something is not right in the organization, they will voice their concern. I will be called outside to say, we need to speak to Liben, he needs to come out, and I have to go out and I have to speak to them. You know, I'll give you an example. A few years ago, we used to end our programs in June. Like when school ends, we stop programs because it's very difficult, childcare, all those kind of things. So we used to end in June. So the seniors came and they said, look, where do you expect us to go after June? And I said, well, you know what? It's also a time when we give our staff some space so they can go on vacation and stuff because they're busy during the year and this is the time they can go on vacation. They said, we have no other place to go. We need the programs to run. And they did a petition and they came to me and they kind of challenged us and we had to negotiate and we had to compromise. So I said, look, you also would agree with me that staff have to go on vacation. We have to give them time to rest so that they can be ready to serve you. So we did a negotiation and I said, okay, I will give you July. We will end our programs end of July, but you have to give us August because that's for staff so that they can go on vacation, rest, and come back in September to start again. So they're very active in making sure that we do what they need to do, and we have a negotiation and we reach at a compromise that makes them feel good because they have used their voice and their position to bring change to the organization.
Right. That's wow. I'm speechless at this point because it feels so like your client is feeling empowered. That itself says so much for the organization. That and this is what you want. Like they considering they're feeling not involved in the community and you're giving that space to be involved, it definitely says a lot.
Yeah.
So yeah, I'm definitely speechless at this point. So recently DBNC and TAIBU collaborated and our collaboration is an ongoing,
Yes.
of course. So how do you think that working together will elevate the impact on the anti-black racism?
No, definitely. I'm very happy and pleased in collaborating with DBNC. The Black History Month event that was organized was very significant.
Absolutely.
And as I always say, and I said earlier on, like, our goal is not just to do some programs together and stuff, at least from TAIBU's perspective. What we really want to do is focus on big picture and system transformation. When you think about system transformation, one organization cannot do it by itself, right? We talked about the system is very ingrained, right? So we need collaboration, we need networks, we need organizations to be of support, to be allies. We also want to engage with other organizations to continue to influence and see what we can bring in from our experience, from our knowledge, and shape what other organizations are doing. So by sharing this kind of knowledge and experience, we build some critical movement, right? So I see this opportunity and partnership with DBNC, to be such that we can continue the conversation, and it doesn't, like, I like building relationship, even with other, funders and other institutions. I always say to them, look, like for example, during COVID, a lot of corporations were throwing money around black issues, right? And we've never seen money given to black organizations like that before. Our approach at TAIBU was great. Thank you very much for reaching out. We will take the money, but at least for me, it is more important that we develop relationship with you on a long-term basis. Because the money you're going to give us, we're going to spend it, it's going to end. But if we build a relationship, we continue to have additional resources. There's some things that you can give us, there's also some things that we can give you. Right? So we have been developing relationship like this, and some relationship have stayed, and we're growing it. So we have regular, like even if there's no funding, we have regular communication and stuff like that. It should be like that. It should be based on relationship building and networking, so that we can all address the systemic issue called anti-black racism. One organization or a couple of organizations are not going to do it. We talked about it, it's very deep-seated. It's ingrained in so many systems and legislations, and it's only organizations coming together, both Black-focused organizations and other social service organizations coming together to address this. And so this relationship with DBNC, it's a great start, and I'm looking forward to continue to build on this relationship. What else can we do? There are some things that DBNC is doing, and you've got the experience and you got it right. Maybe we can learn from that. There are some things that we've done that we can share with you, and that's how we can influence. As I said to you, our mandate is to serve the Black community across the Greater Toronto area. A small organization in the northeast corner of Scarborough will never be able to do that. How can we do it? Is by partnering with other organizations. And we do that. We take our programs to other places, we develop relationship and we have alliances, we go for funding together and we do work together, right? So there is all those kind of things. And there may be some things that we can also bring to DBNC, right? Maybe to the board, as I said, we have a lot of capacity building projects and stuff that we can do to build and influence what DBNC is doing, and we can do it together. If we have organizations coming together, and significant organizations like, DBNC is kind of an anchor institution in this area. If we have another one in another community, a neighborhood, and we all come together to address this issue, we have a better chance of addressing the issue and serving our communities in a better way. So that's my kind of aim. I've already made it clear when we started this relationship. I said I want this long-term relationship, not just this Black History. This Black History Month is our entry point, right? And also, one of the things I also always make sure and share when I engage with other institutions is activities such as these are important, but if they just become like, oh, we've done this and we tick a box, it's not useful. So when I said to DBNC, when we started the relationship, I said, this is what I would like to do. They were excited and said, yes, this is also what we want to do. So I'm looking forward to continuing this journey together, learn from DBNC, share some of our experiences with DBNC, and be able to support the Black racialized communities that you are serving and we're serving in the different parts of the city.
Definitely. I think I can say this from DBNC that we are so honored to obviously be collaborating with you too, with TAIBU, with you, with an organization who's doing so much for the community.
Good, thank you.
So now we've come to the last question of this. I wouldn't call it a podcast, I would call it a chat.
Yes.
Rather, where we would like to know that what would you like to tell your 16-year-old self if you get a chance to go back in time?
Wow, so many things I would say to myself. I did not believe that I would get this far in my journey when I was 16. None of my teachers thought I would get this far in my journey. None of my parents or friends thought that I would get this far. I had a very difficult childhood upbringing and stuff like that. And so, I feel very, very blessed to be in this position, and I know God had something to do with it, because I know it wasn't from me. I've had so many opportunities, like second chance opportunities, and that's what kind of changed my trajectory. We talk with my friends, like when we talk about all these and stuff like that, school friends. So I'm very, very blessed to be in this position. It wasn't the same. So if there was something I would say to my 16-year-old self, or maybe to other 16-year-olds who are out there, I think number one is self-awareness of what is going on in one's life at that stage. It's going to be very important. It's not always easy. Childhood and growing up has its own pain and stuff, but those can be turned into strength, right? Those are experiences can come handy at a later time, and it's always good to be self-aware of why am I behaving like this and what is going right. So I was not self-aware at all. I was just doing everything that just came to my mind and going into troubles and stuff like that because it felt fun and adventurous and stuff like that. But self-awareness is very important. And any negative situation can always turn into positive if we are self-aware, we have the right support around us, and we have at least, it might not be a very elaborate plan of I want to do this, I want to do that, but listening to ourselves and say, what do you really like to do? And follow that, I think from a young age is going to be very important. I always say to young people when I have conversation with them, there is nothing in this world that nobody cannot do. You only need information, maybe education, and opportunity. If you have these come together, you can be anything you want to be. You just have to learn how to do it. You just have to feel it inside you, and that will drive you to say, like, I want to do this. And you need somebody to guide you and say, that's where you can get it. If you have this ingredients, I truly believe there's nothing that you cannot do. If it's truly what you want to do, you get educated about it and you get some guidance to say how you want to do it, everything is possible. As I was growing, like everything felt out of reach. Right? I cannot do that. Oh, like that requires a lot of studying and stuff like that. We were talking earlier on. I went to India to do my university education, and that's when I think things started changing. That's why I like India.
Thank you.
I love India very much. Is because that whenever there used to be back in school, middle school, high school, whenever there used to be a parent-teacher interview, the teachers would tell my father, he is very smart. The only problem with him is he's not paying attention, he's disruptive in class, and he's not doing any of the studies that he's supposed to. It's not that he's not getting it, he's very smart, but his attention is somewhere else. I used to listen to this and I'm saying, well, what do they do? I have my own plan and stuff. But it's only when I went to India and to university, and then I started studying and reading and stuff, and it was very easy. And I said to myself, I could have done even better, because I thought studying and stuff was hard to do. You can only find out if you engage with it. And if it was very easy for me to study and pass exams in university, I think anybody can do it. So you need education, you need information and guidance, and you need to know what you want to do in your life. It's very possible. Yes, there are distractions when you are 16, and maybe childhood challenges and home challenges and things like that may happen. But if you can focus on these three things, I think everything is possible. For me, it didn't turn out too bad. I'm very, very blessed, and I'm grateful to be at this position. But it could have been worse.
No, I love it. Being self-aware and making your weakness your strength. I love that. It's I think the wisest advice that you could give your 16-year-old self. Thank you so much, Liben.
My pleasure.
It has been a pleasure to have you on Elevate, and it has been a very informational chat that we've had.
Yeah, thank you very much. Thank you for this opportunity, for engaging me. I do really appreciate this moment, for sharing some of my experiences and thoughts. Thank you for you personally, Mansi, and the team, DBNC. And hopefully this will elevate the conversation that we have. Right?
Absolutely.
Looking forward to working with the team here at DBNC very much.
Looking forward as well.
Thank you.
Thank you.